Now, I'll invite the panelists so we can have a very quick discussion. Sarah, I'm going to ask you the first question because we've got one from the audience. And if you do have questions from the audience, please put them in. Is there any data about the prevalence of GDM in Muslim women in the Western Sydney area, which we know is quite a hotspot for diabetes, particularly in New South Wales?
So to answer that question, I'm not aware on specific data looking at the denominator being Muslim women who are pregnant and the numerator being prevalence of gestational diabetes within that cohort. However, what we do know is compared to the rates of gestational diabetes across New South Wales or across Australia, the rate of gestational diabetes within Southwest Sydney specifically, because that's what I'm familiar with, and Bankstown Hospital, the rate is much higher. And within that population, we do have up to 30% of people from a Middle Eastern background. So, and a lot of them will be of Muslim background. And also Western Sydney, we have a lot of South Asian background. So people from a background from Bangladesh, Pakistan, and they also tend to be majority Muslim. So we do know that the rates amongst these groups are going to be slightly higher, which follows what we know about prevalence of diabetes amongst these ethnic groups. But percentage-wise, I don't know specifically.
Thanks, Sarah. Dr. Azmi, sorry, yes. There
is a question perhaps yourself could be involved in as well as other colleagues. Now, much of what we've discussed this morning, whether it's pregnant or elderly patients, is very much related to the perception of the individual, and the impact of the religious authorities here is very high, because it does look to me, as an observer for what Ramadan practices in diabetes, that many people believe that pushing themselves beyond the health issues is good from them from a religious point of view, which I think is contradicting the facilities and the license in Quran. So a question to you about Australia, and perhaps could be taken also by other colleagues in Malaysia or Indonesia. Is there a role for the societies to engage with the clerics as well as the community leaders about these points?
Yes, there is. And I think we've got a comment and a question about that in our chat. The ADS has an important role, and we probably need to be a little bit more proactive in doing so. We do have resources for health professionals, for patients who are Muslim and have diabetes, but also for the religious leaders, for the imams on our website. We need to actually promote them and do a much better job in improving the awareness. I did last year, as just an addition to this, Mohammed, I did last year approach Basha Houli, and Basha Houli is a footballer in Australia who has a foundation for Muslim people and promoting Muslim people across sporting and other achievements. And I did send the Houli Foundation the resources that we have so that they can try and promote and raise awareness about what you would do if you have diabetes and you would like to fast during Ramadan. I'm going to come back to Dr. Azmi because he showed very interestingly that your psychology, your mental health actually improves after Ramadan, which I can understand because you feel much better. So what do you think, Azmi?
That's the thing though. This is one aspect that we have often overlooked, the psychological effect, the psychological improvement that patients experience, especially among the elderly. That data from Mansoor Ashok. The numbers with depression reduced markedly by half. Their anxiety state, they become less anxious. So, but that doesn't negate the fact that we have to be very selective though in allowing elderly to fast, because of the obvious risk factors. I noticed as a question from one of the audience. asking whether there's an age limit beyond which we will not recommend fasting, irrespective of the medical condition. I think we need to understand though, population is aging throughout the year, throughout the world. Every population in the world is now aging, and there even is. I'm sure some of you have heard. There's even a push to say that perhaps we need to increase the age limit criteria for elderly from currently 65. Some of us are advocating 80, 80 or beyond. So there is no age limit. We have to clear that there is no age limit by which fasting is prohibitive. What matters most is, number one, as we have discussed at length just now, was their functional state, their frailty, their cognitive function, and of course their CVD risk factors, their comorbid. These are at least 4 of the aspects you need to look though before deciding whether someone is allowed to fast or not. But general speaking, there is no age limit that automatically say that's it. You reach age 90 or 100, you are excused from fasting. So I think we have to be clear on that.
Thank you. Sarah, just to take on Professor Hassanein's comment, how do we get the message out there? I think you spoke about education. You spoke about raising awareness and counselling women who are planning pregnancy. Is it your role as a endocrinologist to do that? Do we need to involve the leaders, the community leaders, the religious leaders, scholars?
Yeah, so look, I think that it should be multi-pronged, Soph, and I agree that we have a responsibility to ensure that everybody is on board with the same message. And as Dr. Hassanein mentioned, because people do look towards the imams, it is important that they are having the same message that we have. And I really like Dr. Azmi's presentation, the way it started, which is the 5 basic foundations of Islam, and that protecting health and life is really important. So I use that in individual counseling, in that you are not doing yourself any favor, or you're not doing any increased religious practice by fasting and harming yourself. So from an individual level, I can give that practice to my patients. I can give that information. Not every practitioner is doing that. And unfortunately, I think that there are even some health practitioners that are not on the same page as us. So then some health practitioners are saying, oh, you know what, you're healthy, you're pregnant, what's the problem? Just fast. Okay, and that mixed message dilutes what we're trying to say. So I think if we all have we're all on the same page, so individual level to our patients, and then community level. So the role for Australian Diabetes Society will be for us to make contact with some of our imams. That way they can mention that in the sermons they do before Ramadan. That's the easiest way in Australia. Pre-Ramadan sermons, everybody listens to that. They're in a heightened state, and mentioning, if you do have health problems, please seek out your doctors. Please listen to the health advice. That's the most important thing you can do. So that's what we can do from a diabetes society point of view, is that we can explain that there are metabolic derangements. Even though someone feels well on the outside, that there are things going on the inside, and that patients with diabetes should always be encouraged to talk to their health practitioner well before Ramadan and plan what they're going to do. So just from a diabetes society point of view, that's what we should be doing, is making sure that we give the imams the right information so that they know that diabetes is an important condition, to remind their people to seek discussion with their health practitioner about.
And if I comment on this, obviously the guidelines also have the fatwa, the opinion of Al-Azhar, and what we're doing this year, or what we're planning this year, is a campaign involving the imams in the native language, where we would have an imam, we'll have a diabetologist and a nutritionist, which will be titled Between Religion and Health, or Science rather, because I think the message is lost. Many healthcare professionals, and indeed many patients, push themselves beyond what is good for their health. And absolutely, the point that Dr. Azmi have put is the protection of health is sometimes lost with the passion to fast. So I think we've heard a fantastic session. We can carry on chatting until tomorrow, but we have to proceed on. We are already 10, 15 minutes late. I'd like to thank all the speakers very much, and I'd like to thank Sof, the co-chair, and we look forward to Australia always being on board with us in the Ramadan activities. Thank you all, and I hand over to the moderators for the following session.